Have you ever wondered why, in some cases, antibiotics that were once effective become seemingly powerless? Welcome to the world of antibiotic resistance, a phenomenon that is rapidly changing our approach to treating infections and diseases. Antibiotic resistance is a natural process, but it's being accelerated by the overuse and misuse of antibiotics. Essentially, bacteria and other microorganisms evolve over time, developing mechanisms to survive the drugs designed to kill them. When antibiotics are used frequently, these resistant bacteria multiply and spread, creating a significant health concern. These resistant bacteria are crafty. Some of them can effectively pump the antibiotic out of their cells before it can do any damage. Others can change the site where the antibiotic is supposed to act, rendering it useless. In some cases, bacteria can even form a protective barrier called a biofilm that antibiotics cannot penetrate. This resistance doesn't just affect the bacteria that are being treated. It can also transfer to other bacteria, spreading the resistance further. When antibiotics fail to work, infections persist. For instance, patients with chronic diseases, around 5 to 7% of them, often exhibit antibiotic resistance. They suffer from severe weakness and toxicity, manifesting in symptoms like elevated levels of white blood cells and C-reactive protein. Treatment for these patients becomes more symptomatic, focusing on managing the symptoms rather than eradicating the bacteria. Therapies like intravenous ozone therapy are being explored to combat this resistance. Ozone therapy destroys the protective barriers of the bacteria, allowing the antibiotics to do their job. Take, for example, a young patient from Israel who suffered from ulcers that hadn't healed for 6 years due to complete antibiotic immunity. After 3 weeks of high-dose ozone therapy, paired with dressing the ulcers with an ozonized solution, the ulcers healed. Understanding and combating antibiotic resistance is crucial. It's about ensuring that we can continue to rely on these life-saving drugs in the future.